Let's talk about the social determinants of health. We're going to begin with a story. Why is Jason in the hospital? Because he has a bad infection in his leg. But why does he have an infection? Because he has a cut on his leg and it got infected. But why does he have a cut on his leg? Because he was playing in the junkyard next to his apartment building and there was some sharp, jagged steel there that he fell on. But why was he playing in a junkyard? Because his neighborhood is kind of run down. A lot of kids play there and there is no one to supervise them. But why does he live in that neighborhood? Because his parents can't afford a nicer place to live. Well, why can't his parents afford a nicer place to live? Because his dad is unemployed and his mom is sick. But why is his dad unemployed? Because he doesn't have much education and he can't find a job. But why?
Do you think it was Jason's fault he has a cut on his leg? Actually, that's a little bit of a trick question. If you said yes, it's not actually Jason's fault. It's due to a number of other factors, which we talked about in the story. Altogether, these factors are called the social determinants of health. The definition of social determinants of health is the conditions in the places where people live, learn, work, and play that affect a wide range of health risks and outcomes.
That was a lot of words, so we're going to go into some examples. First example is socio-economic factors, and these would contain a wide variety of things. For example, education. In the story that we covered, Jason's dad didn't have a lot of education, and he found it that it was really hard for him to find a job. Having your high school or even college or vocational school degree can make a big difference on whether or not you're able to support yourself and your family. Family and social support is also incredibly important. In the story, Jason's mom was really sick, and so Jason didn't have anyone to look after him. Additionally, his mom was sick and her husband was at work, and so she might have been having trouble taking her medications on time or going to the doctor's office. Having safety in your community is also important. Jason lived next to a junkyard, whereas someone else his age might live next to a playground with wood chips and sandboxes. So when they fall, they won't hurt their knee, but when Jason fell, he got a really bad cut. Physical environment is also so important. It's important to feel safe where you live. If you live in an area where you feel like you might be attacked or you don't feel safe at night, then it can make a huge difference on your health. Perhaps you have a heart condition and your doctor tells you that it's really important for you to exercise every day, but you work until 6, 7, 8 p.m. and then that's the only time you have to exercise, but it's already dark outside and you don't feel safe. Or if you live next to a highway, you wouldn't feel comfortable running alongside it. Well, you might be thinking, why don't they just go to the gym? Unfortunately, not everyone can afford a gym. And so it can be really difficult for some people to exercise if their physical environment is not safe. Health behaviors are also incredibly important to your health. If you decide to smoke, it can have huge consequences not only on your lungs, but your whole body, and predispose you to a lot of cancers. Diet and exercise is also incredibly important. Dieting, when I say dieting, I mean eating healthy foods, not necessarily restricting, can be difficult if you live in a food desert. A food desert is an area where there aren't a lot of grocery stores. These people often live in areas where they have to drive really far, or they don't even have cars at all. The only things that are close to their homes might be a gas station or a McDonald's, and you can't really find healthy options there easily. Is alcohol good for you? It's a trick question. Alcohol in moderation won't necessarily have harm to your health, but if you misuse or abuse the amount of alcohol you drink, it can lead to long-term health problems. Additionally, if you drink and drive, it can lead to bad effects on the health of yourself and those around you, or it can also lead to bad relationships with your friends and family. Sexual activity, just like alcohol, isn't necessarily bad. However, it's very important to always practice safe sex practices in order to prevent unwanted pregnancies, sexually transmitted diseases, and sexually transmitted cancers. Lastly, healthcare is something that we're going to talk about in another video, but having healthcare access at all times is incredibly important because you never know when you might get into an accident or need to see the doctor, and having to pay healthcare bills all by yourself can be incredibly strenuous on your wallet.
So why does all of that matter? Why do you even need to know about the social determinants of health? It's because, unfortunately, your doctors are human, just like you. They can be tired or grumpy or forgetful, and they don't know you or your specific situation. So you need to tell your doctor if you can't afford the medication or treatment that they prescribe. Or maybe they say to exercise, but you don't have access to a park or a gym. Or they say, eat healthy, and you live in a food desert and don't have access to a grocery store. Or maybe they prescribe you a treatment, but your job impacts your health and makes that treatment impossible. There are alternatives available. If you talk to your doctor, they can find you a more affordable medication. Or there are programs that can drop you to and from grocery stores so you can get fresh produce. Or they can adjust the treatments so it works with your job. The main point is, if you think about your social determinants of health, you can get better health care. And it's up to you as a patient to make sure you're going to get the best health care possible.